Now we will discuss about one more content in the orbit, that is ciliary ganglion. See, this is ciliary ganglion. It is one of the peripheral parasympathetic ganglia. It is around 3 millimeters in diameter. It is present at the apex of orbit and it is sandwiched between the optic nerve and lateral rectus. That means it is present in between the lateral rectus and optic nerve. That means imagine this is lateral rectus and this is optic nerve. In between these two there will be ciliary ganglion, right? And it is hanging to the, what is this nerve? Nasociliary nerve. This is nasociliary nerve. Nasociliary nerve is branched from the ophthalmic division of trigeminal nerve, right? That we will discuss. So this is nasociliary nerve. This ganglion is hanging to the nasociliary nerve, right? So topographically it is attached or it is related with the nasociliary nerve, but functionally it is not related to the nasociliary nerve. Functionally it is related to third cranial nerve. Functionally it is related to third cranial nerve. So this is the introduction about the ciliary ganglion. Very simple. It is one of the peripheral parasympathetic ganglion. It is around 3 millimeters in diameter and it is topographically related to the nasociliary nerve, but functionally it is related to third cranial nerve, that is oculomotor nerve, right? And it is present at the apex of orbit and sandwiched in between the optic nerve and lateral rectus muscle. Then what are the different roots ciliary ganglion having? Actually ciliary ganglion having 3 roots. Ciliary ganglion having 3 roots. One is motor root or parasympathetic root and another one is sympathetic root and one more is sensory root. Parasympathetic, sympathetic and sensory, right? So we have to discuss parasympathetic nerve fibers which are passing through the ciliary ganglion, sympathetic nerves passing through the ciliary ganglion and sensory nerves which are passing through the ciliary ganglion, right? First, if you take parasympathetic fibers or motor fibers or parasympathetic motor fibers, right? So this is the midbrain. See, this is midbrain. Around the aqueduct of Sylvius you can see the grey matter, is it? Must be aware of it. See, this is midbrain. At this session you don't worry about this, we will tell you in the neuroanatomy. This is grey matter. Here you can find nuclei. What are these nuclei? Edinger-Westphal nucleus. What are these? Edinger-Westphal nucleus. Edinger-Westphal nucleus, right? So from the Edinger-Westphal nucleus preganglionic parasympathetic fibers arising. So these are preganglionic parasympathetic nerve fibers. These fibers passing through the third cranial nerve, is it? So they are passing through the third cranial nerve, right? So third cranial nerve is passing through the lateral wall of cavernous sinus. So these fibers also passing through that. Then this nerve will be passing through the superior orbital fissure, is it or not? But before entering into superior orbital fissure, oculomotor nerve divides into upper division and lower division, right? Now these fibers are confusing through which division it has to pass. These fibers will decide and they pass through the lower division of oculomotor nerve, right? Again this lower division of oculomotor nerve will be giving different branches, nerve to the inferior oblique, nerve to the inferior rectus and nerve to the medial rectus, is it? But these fibers passes through the nerve to the inferior oblique. Imagine this is nerve to the inferior oblique, right? Then these fibers will be entering into the ciliary ganglion, right? So there will be communication from the nerve to the inferior oblique to the ciliary ganglion, right? So through that communication these fibers are passing into the ciliary ganglion, right? These are preganglionic nerve fibers, right? Now within the ciliary ganglion, these nerve fibers will relay. That means they will end up, preganglionic fibers will end, postganglionic fibers will start, right? From here postganglionic fibers are starting. From here postganglionic fibers are starting. These fibers pass through the short ciliary nerves. They pass through the short ciliary nerves. That means postganglionic fibers pass through the short ciliary nerves. These short ciliary nerves pierces the sclera, is it? Once they pierce the sclera, they enters into space in between the sclera and choroid, is it? So through that space these nerve fibers are passing and they reaches to where? They reaches to ciliary body and constrictor pupillae. So they supplies to ciliary body and constrictor pupillae, right? So if there is stimulation of parasympathetic nerves which leads to constriction of pupils and constriction of ciliary body, so that lens become more convex, right? It is helpful in the accommodation reflex, is it? So that is about parasympathetic relay. This is very important, right? Remaining things are very easy, but this relay you have to remember. Recollect once again. Edinger-Westphal nucleus in the midbrain. From there only preganglionic parasympathetic nerve fibers will be arising. So these preganglionic nerve fibers passes through the oculomotor nerve, right? This oculomotor nerve passing through the cavernous sinus, then it is passing through the lower division of oculomotor nerve. Actually this lower division of oculomotor nerve passing through the superior orbital fissure, that to central part of the superior orbital fissure. Then it passes through the nerve to the inferior oblique. Then it will be communicating with the ciliary ganglion by communicating branch, right? So within the ganglion these fibers are relaying. That means preganglionic fibers are ending, postganglionic fibers are starting, right? So this is preganglionic neuron and this is postganglionic neuron, right? So this postganglionic neuron from the ciliary ganglion pass through the short ciliary nerves, pierces the sclera, enters the space which is present in between the sclera and choroid, right? Then passes within that space, reaches to the ciliary body and constrictor pupillae and they supplies there. If there is stimulation of parasympathetic nerves which leads to constriction of pupils and constriction of ciliary body because of constriction of ciliaris muscles. Clear? So that is about parasympathetic root. Then what is another root? Sympathetic root. Sympathetic root. Sympathetic root, I am removing this. I am drawing spinal cord. Spinal cord having the anterior horn, posterior horn and lateral horn also. Is it? So sympathetic nerve fibers are arising from the lateral horns of spinal cord. From here these nerve fibers, here central canal, from here these nerve fibers are arising. That means preganglionic nerve fibers are arising, pass through the anterior root and they will relay in one ganglion. What is that ganglion? Superior cervical ganglion. Imagine this is superior cervical ganglion. So preganglionic fibers are relaying in superior cervical ganglion, right? From here postganglionic fibers will be arising, no? This is sympathetic root. So postganglionic fibers comes out from the superior cervical ganglion and they forms plexus around the internal carotid artery. Imagine this is internal carotid artery. So this is internal carotid artery and here ophthalmic artery. Clear? So these sympathetic nerves forms plexus around the internal carotid artery, then ophthalmic artery, and these nerves, that means sympathetic nerves, they enters into where? They enters into ciliary ganglion. Then after passing through the ciliary ganglion, they will not relay here because already they have relayed here. So these are postganglionic fibers only. That's what, there is no relay. Without relaying, these fibers will be entering into the short ciliary nerves. They enters into short ciliary nerves and they reaches to the sclera, and these nerve fibers also piercing the sclera because short ciliary nerves are piercing. Clear? So these nerve fibers pass through the short ciliary nerves, then they enters into space between the sclera and choroid, then they runs within that space and they reaches to dilator pupillae. They reaches to dilator pupillae and blood vessels of eyeball. Dilators of pupillae and blood vessels of eyeball. Right? So this is what? This is sympathetic root. If there is stimulation of sympathetic nerves, what will happen? There will be dilatation of pupil and vasoconstriction. Clear? So that is about sympathetic root. Recollect once again. Sympathetic root from the lateral horns of spinal segment. These are preganglionic fibers. Preganglionic fibers pass through the anterior root, then they relay in the superior cervical ganglion. Right? Postganglionic fibers will be arising from the superior cervical ganglion, then they forms plexus around the internal carotid artery and also around the ophthalmic artery. These nerves entering into ciliary ganglion. Once it passes through the ciliary ganglion, they will not relay there because already they have relayed here in the superior cervical ganglion. Just they pass through it and they enters into short ciliary nerves. Right? So these fibers enters into short ciliary nerves. Right? And through the short ciliary nerves, they pierces the sclera and enters into subscleral space. That means space between the sclera and choroid. Within that space, they travels anteriorly, they supplies to the dilator pupillae. Clear? So that is about sympathetic root. Then what is remaining? Sensory root. Sensory root means sensations are coming from the eyeball. Pain, touch, temperature sensations. Right? Those sensations from the eyeball, they also runs in the same space, and some fibers they pass through the nasociliary, right, and some fibers they pass through the short ciliary nerves, right, then they pass through the ganglion, but here no relay. Without relay, just they pass through the ganglion. So just they pass through the ganglion. These fibers are again entering into where? Nasociliary nerve only, right? So this nasociliary nerve, just its schematic diagram. This nasociliary nerve is branch of what? It is branch from the ophthalmic division of trigeminal nerve. So this is ophthalmic division of trigeminal nerve. This is ophthalmic division of trigeminal nerve. This is maxillary nerve, and this is mandibular nerve. Is it? Actually, this is fifth cranial nerve. Is it? So this is trigeminal ganglion. Of course, this ophthalmic division of trigeminal nerve will give lacrimal branch, then frontal branch, and nasociliary. Right? So this is nasociliary nerve. Clear? So these fibers, these sensory fibers, they pass through the nasociliary and they reaches to brain stem, right? So this is sensory root. Very simple. Pain touch temperatures are carried by this sensory root. These fibers are passing through the ciliary ganglion but no relay. Clear? So this is about ciliary ganglion and different roots of ciliary ganglion. So that's it about ciliary ganglion. Now we will discuss about one more content in the orbit, that is optic nerve. Optic nerve in the orbit, only that part only we will discuss. Actually it is around 4 centimeters length. It is nerve of sight. Optic nerve surrounded by dura mater, arachnoid mater, pia mater along with subarachnoid space. It is extending from the posterior pole of orbit, that too not exactly from the posterior pole. Imagine this is the anterior pole, this is the posterior pole, right? Just medial to the posterior pole, that means 3 to 4 millimeters nasal to the posterior pole. Nasal means what? Medial, right? So from here optic nerve is arising, right? Optic nerve is formed by axons of ganglionic cell layer of retina. It is around 4 centimeters in length. We are dividing that 4 centimeters into 3 parts. So this part which is present in the orbit, this part which is present in the optic canal, and this part which is present in the cranium. So this is orbital part, this is canalicular part, and this is intracranial part, right? So these are the 3 parts. It is extending from the 4 millimeters nasal to the posterior pole of eyeball, then it extends back within the orbit. When it reaches to the optic canal, it passes through that canal and enters into cranial cavity and joins the optic chiasma, right? So this is course. If you come into the relations here, that means at the apex of orbit, see here, this is apex of orbit. Surrounding this there will be common tendinous ring of Jin. That means surrounding the optic nerve we can find the recti muscles at the apex, right? Then if you see in the posterior part of the optic nerve, below and laterally what is there? Ophthalmic artery is there. Then optic nerve is crossed by, that means optic nerve is crossed superficially by, what is this artery? Ophthalmic artery along with nasociliary nerve and superior ophthalmic vein. That means these 3 structures are crossing from lateral to medial side. What are those? Superior ophthalmic vein, ophthalmic artery, nasociliary nerve. These are the structures crossing the optic nerve superficially. Deeply also one structure is crossing, that is nerve to the medial rectus, right? Then any other relations are there that we have already discussed in the ciliary ganglion. Ciliary ganglion is present lateral to the optic nerve at the apex. That means ciliary ganglion is present in between the optic nerve and lateral rectus. Is it or not? Then any other relations are there? See, this is central artery of retina. Central artery of retina, it is present in the lower part of the, or it is present inferior to the optic nerve, up to where? Up to 1.25 centimeters behind the eyeball. 1.25 centimeters behind the eyeball, this central artery is piercing the nerve. So that from there, if you take the section within the substance of the nerve, you can find the central artery. That means central artery related inferiorly and within the substance also. Clear? So these are the relations of optic nerve. Then if you coming to the structure, it is formed by 1.2 million nerve fibers. These nerve fibers are from the ganglionic cell layer of retina. If you wanted to say specifically, optic nerve is not nerve, it is tract, because it is present in the central nervous system. Bundles of nerve fibers which are present in the central nervous system, what we are calling tract. Bundles of nerve fibers which are present in the peripheral nervous system is nerve. It is not peripheral nerve. So this is not nerve, strictly it is tract. If there is any degeneration or any injury to the optic nerve, there is no regeneration, because nerve fibers are not having the neurolemmal sheath. So that is about optic nerve.